Welcome to The Explainer. Okay, today we are looking at a medical breakthrough that honestly feels like it's straight out of a sci-fi blockbuster, but trust me, it is very, very real. The future of surgery literally just scrubbed in. We're going to dive into a groundbreaking medical first where humanoid robots, and yes, I mean robots built to move and function just like us, successfully perform surgery on a live patient. So grab your scrubs because this is going to be absolutely fascinating.
Here's our roadmap for today. First, we're going to look at this groundbreaking robotic surgery. Then, exactly how this robot, called Surgi, operates. After that, we'll explore the massive humanoid advantage, how this tech could cure healthcare deserts, and finally, a reality check on when you might actually see one.
All right, Section 1, a groundbreaking robotic surgery.
Picture this. You walk into an operating room. The lights are glaring, the monitors are beeping. But standing over the operating table isn't a human surgeon in scrubs. It's a humanoid robot holding the surgical instruments. I know, it sounds totally made up, but researchers at the University of California, San Diego have actually pulled this off. They successfully used humanoid robots to perform laparoscopic gallbladder removals on live pigs. We're talking about highly precise, minimally invasive surgery inside a living, breathing patient, executed by machines designed to mimic human movement. It's a monumental leap forward for medical tech.
And just to prove this wasn't some crazy one-off fluke, the research paper details that they actually conducted 2 distinct operations to put this entirely new technology to the test. In the first procedure, a humanoid robot took the lead as the primary surgeon while a human assistant helped out. But the second procedure, there were no humans at the table. It was a duo made up entirely of robots. 2 machines working together over the surgical bed, completing the procedure successfully.
Moving right along to Section 2, how Surgi operates.
You know, the researchers didn't actually spend decades and millions of dollars building a custom robot from scratch just for this experiment. Instead, they did something kind of brilliant. They started with a commercially available Unitree G1 humanoid robot, which they nicknamed Surgi. By modifying its mechanical hands to grip and manipulate the exact same minimally invasive instruments used by human surgeons, they created a highly capable surgical tool out of accessible, off-the-shelf technology.
Now, before anyone starts panicking about a rogue AI with a scalpel, let's clear something up really quick. Surgi is not an autonomous AI making independent medical decisions. These robots absolutely do not operate independently. In every single test case, highly trained human surgeons were remotely controlling the machines, guiding their every movement from a distance. So really, think of the robot as just a physical extension of the human surgeon's own hands, perfectly translating their expertise into the operating room from afar.
So how exactly does this human-robot connection pull off something as complex as surgery? Well, Surgi successfully performed a super precise sequence of tactile tasks right there in the liver beds of those pigs. Step 1, safely retracting the delicate tissue. Step 2, dissecting the area precisely. Step 3, clipping the necessary vessels. And Step 4, completely removing the gallbladder. The robot translated the remote human surgeon's micro-movements perfectly to execute every single step. And the sequence, it marks a massive, incredibly important step toward future human trials.
Okay, Section 3, the humanoid advantage. Now, you might be wondering, wait, don't we already have robotic surgery? We do, but look at the stark contrast here. On the left, we have Surgi. It costs less than $20,000, stands about 5 feet tall, weighs roughly 60 pounds, and is fundamentally adaptable for a whole wide range of jobs, mostly because, well, it's shaped just like us. On the right side, you've got traditional robotic systems. These things are known for their massive size, enormous cost, and the fact that they are highly specialized, basically built for a very limited set of tasks. Surgi's small size and simple setup, that's a total paradigm shift.
Dr. Shanglei Liu, one of the paper's senior authors and the actual surgeon who remotely controlled the robot during the surgery, puts this perfectly into perspective. He says, it's a fraction of the cost, and it takes a fraction of the space in an operating room. Because of that incredibly simple setup, Surgi is exceptionally easy to deploy almost anywhere. You don't need a specially reinforced floor or some massive custom-built surgical suite to use it. Which brings us to Section 4, curing healthcare deserts.
This ease of deployment matters on a really profound human level. According to GoodRx data, more than 80% of the U.S. population lives in areas dealing with some form of healthcare infrastructure shortage. To put that into perspective, that leaves roughly 1 in 3 Americans, 33%, living in actual healthcare deserts, where adequate access is just severely lacking. And that's just in the United States. The worldwide numbers are even more staggering. Entire communities simply do not have the surgical staff they desperately need.
That is exactly why Surgi is such a game changer.
We are talking about the potential to drop a remote-controlled humanoid robot into rural hospitals, remote communities, intense search and rescue scenarios, active battlefields, and yes, even space. Michael Yip, another senior author on the paper, pointed out that you can imagine deploying these robots in austere environments where you need a massive deployment of field medicine in a very short amount of time. This cheap, flexible tech could literally bring life-saving surgery to places that currently have zero access to it.
Finally, Section 5, Reality Check and Next Steps. It all sounds totally amazing, I know, but let's take a grounded look at where this technology actually stands right this second. Don't expect to see a robot standing over you the next time you go in for a procedure. There are still some pretty key technical challenges that have to be overcome before human trials can even begin. During the pig surgeries, the robots required frequent recalibrations. There's also a delay, a bit of lag between the human surgeon's movement on the remote controls and the robot's physical response. Because of this, the operations took far longer than similar surgeries performed with today's specialized systems. But the researchers impartially note that these growing pains are completely normal with emerging tech. The team is actively working right now to eliminate that lag and speed things up over time.
So what does the immediate future actually look like? Well, before Sergi is holding a scalpel over a human, its most realistic near-term gig will be acting as a capable surgical assistant. Rather than replacing surgeons, these humanoids could fetch tools, prep the equipment, and even clean up after a procedure. Given just how many communities are struggling with severe staffing shortages on their surgical teams, having a tireless robotic assistant doing the heavy lifting, that could dramatically ease the burden and ensure way more patients get treated.
This whole idea of assistance builds an incredibly collaborative global vision for the future of healthcare. As senior author Michael Yip says, our goal is an operating theater of the future where humanoid robots and humans work side by side as an integrated team to deliver procedures to those in need, both in traditional hospital settings as well as in non-traditional field medicine scenarios. I love that. It's not humans versus machines, it's humans and machines teaming up to save lives.
Which leaves us with a pretty fascinating final thought. Will your next surgical assistant be a robot? As technology like Sergi continues to rapidly develop, that reality is getting closer every single day. Thank you so much for scrubbing in and joining me for this explainer. I really hope you grasped just how transformative this breakthrough actually is. Keep wondering, keep learning, and I'll see you next time.